Well, hi there, and welcome. Today I want to talk specifically to new nurses, especially those of you who might be feeling overwhelmed, unsure, or maybe even a little afraid because maybe you don't think you know everything that you need to know. And I want to begin by saying this. You don't need to know everything, but you do need to know when to ask for help. I know this from my own clinical experience. Even though it was 50 years ago, it's remarkably similar, the experience, to what you might be having today. So, when I graduated, I came from a 2-year community college program. I had all the required clinical hours, but I didn't have a great deal of overall experience. And there were many things I had actually never done on my own. One experience I remember very clearly involved inserting a urinary catheter into a female patient. I had never done this before. And I kept telling myself what I had been told while I was in school, that if you understand how to do it, you can do it. So I set everything up. I knew the protocol. The patient was so gracious. I was honest with her and told her that I had never done this before, and she was actually cheering me on. But I remember holding that catheter and thinking, this is never going to fit into that opening. And I froze. I just couldn't do it. I didn't want to hurt her. So I contacted my supervisor and just honestly shared my limits. And thankfully, she was very understanding and very helpful. And that experience taught me something important. Honesty is safer than pretending to know. I'll give you another example because I have so many actually from that first year. I also remember that I never actually hung an IV during my clinical education. And once again, being honest about my limited experience and asking for help mattered. And this is something I want new nurses to hear very clearly. You are not weak because you ask for help. And you're certainly not failing because you need guidance. What you are doing is practicing safely. And I know that given today's use of technology, it could be very tempting to quickly Google something or watch a video on your phone about a procedure or something you're not sure of. And yeah, there's certainly a lot of good content and helpful content on the web. But in the heat of that clinical moment, when a patient is waiting and maybe you're a little anxious or a lot anxious, this is not the time to evaluate whether the information is reliable, current, or even appropriate for that particular situation. This is the time to follow your workplace policies, use your clinical resources, and ask someone who's experienced for help. I had another interesting new nurse moment. I remember being involved in giving intramuscular injections of procaine penicillin to patients who had very little muscle. I don't think procaine penicillin is still being used today, but it was this really thick, viscous, white substance that needed to be injected deep into the gluteal muscle. I may have given 1 or 2 injections at the most during my clinical education, but I had never given one to someone who was basically skin and bones. And these patients on the unit I was on were often very malnourished. They were dealing with alcoholism and drug addiction. And that kind of situation that you might find yourself in will certainly contribute to you feeling very insecure. And when you're brand new, that insecurity can become very tense. And what happens then? Well, what happens then is that the insecurity you may be feeling, combined with the pressure of many clinical settings back then, as it is now, can easily create a stress response in your body. And when your anxiety gets too high, your attention gets more narrow, and you may not be able to think as clearly. You could miss things, important things. You may not function as fully as you normally would or want to. And I certainly experienced this myself during that first clinical year. As a new nurse, I worked on a 45-bed male medical ward, because they had wards back then, that also served as an ICU for patients without insurance. I was not fully prepared for what I had to deal with, and the stress very quickly led to burnout after only 9 months. So hear me, please, when I say, don't ignore your stress. Recognize your limits, ask for mentoring, and seek guidance. And also find small ways to reset your nervous system, because you will need to do this, not just as a new nurse, but throughout your career. Even something as simple as taking a few slow, focused breaths can help you lower your stress response. And if that's not possible, what happens as a result often is that compassion can be difficult when you're under that kind of stressful pressure. In those clinical environments, it can often feel really difficult to be compassionate. Many times you're dealing with patients who are frightened, demanding, even angry or aggressive. I certainly dealt with that. On my unit, many patients were dealing, as I mentioned, with alcohol dependence, substance use, abuse, poverty, fear, and most of them had little to no support. So they were emotionally already on the edge. And if I'm being completely honest, I didn't always handle those situations well. But over time, I learned that it helps to take a pause, just for a moment, and ask yourself, what might life feel like for this person right now? That one question can really help bring compassion back into the room. And not only patients and their families, but also your colleagues are under the same amount of stress that you are. And when you put all this together, the stressful environment, the lack of experience, the fear of making mistakes, it can also make colleagues act in ways that sometimes aren't helpful or even kind. Sometimes people may seem very impatient. And as I mentioned, sometimes, unfortunately, they can even be unkind. But remember, often this is really not about you personally. So when you can, try not to hold on to it. Let it pass like a storm. And look for small ways to bring a little kindness into that space. On my unit, we had something called liver rounds once a week. And that meant that people went to the roof and had some drinks. That was how people coped back then. Certainly not something I would recommend now, but it did bring people together, and it helped people acknowledge the stress that they all shared. As I got more experienced and in later years, I found a much better way. I would bring something into the break room, maybe chocolate or something special from a local bakery, or maybe even something I made over the weekend. Small gestures like that can communicate kindness. And they tend to remind people that we're all human beings working together in very difficult spaces. So, for the new nurse who's listening today, you don't need to know everything. You need to be honest, and you do need to ask for help. And you especially need to protect your nervous system. And finally, and very importantly, you need to remember that kindness matters, whether it's towards your patients, your colleagues, and even yourself. This is Nonna Nurse, bringing you a little warmth, a little wisdom, and a reminder that you don't have to figure it all out alone. For more support, resources, and reflections, visit me at nursingprofessor.com.